preparing medication from an ampule and vial, and parenteral medication administration, return demonstration. Hi, my name is Gerald Ababa Becerra, and today I will perform the parental medication administration return demonstration using subcutaneous and intramuscular injections. So prior to the procedure, the first thing that we should do is to check the doctor's order to know what medication should be given to the assigned patient. Okay. After this, we must check the MAR medical administration record to confirm the patient's identification matches the MAR and medication label, which guarantees that the medication is given to the correct patient. Now we should check the label on the medication carefully against the EMAR to make sure that the correct medication is being prepared. And read the label on the medication and follow the 3 checks for administering medications, which is when is taken the medication cart. Next is before the withdrawal the medication, and after withdrawing the medication. Now, we will organize the necessary equipment. So the equipments that we will be using are insulin syringe, which is 1 cc cubic centimeter for subcutaneous injection. Next is a 23 gauze syringe, which is 3 cc for intramuscular injection. Next is a vial, which will serve as the medication used in the demonstration. And lastly, the alcohol swabs. Next is medicine tray, since I don't have any hypodermic tray. And lastly, waste receptacle to dispose the used. Now, for preparing the medications from vials, prior in the preparation, we have already done hand washing technique, but we have to make sure that we perform hand hygiene and observe other appropriate infection prevention procedures. In preparing the medication vial for drug withdrawal, first mix the solution if necessary by simply rotating the vial between the palms of the hand and not by shaking, because some vials contains aqueous suspensions which settle when they stand. In some instances, shaking is contraindicated because it may cause the mixture to foam. So this is the medication. Now, remove the protective cup or clean the rubber cup of a previously open vial with an antiseptic wipe by rubbing in circular motion. So the antiseptic wipe cleans the cup and reduces the number of microorganisms. So let us use the alcohol swab. And discard it. Next, in withdrawing the medication, so we are using the 1 cc syringe. We have to first open the package of the needle. So let us open the package of the needle. So we have opened the package. Next is attach an aspirating needle as agency practice dictates to draw up pre-mixed liquid medications from the multi-dose vials. So using the needles prevent any solid particles from being drawn up through the needle. So this, we should get this needle. It's original needle. Put it back and open some aspirating needle. So this is the aspirating needle. So insert. Okay, hold on. Next is ensure that the needle is firmly attached to the syringe. The needle is perfectly attached to the syringe. Now we have to open the medication vial and expose the rubber seal. Earlier I have already rubbing the rubber cup using the alcohol swab. Next is we have to sterilize the surface of the rubber seal using alcohol swab and do this for 30 seconds. So I have already do that earlier. Okay. Now we will remove the cup from the needle, then draw up into the syringe the amount of air equal to the volume of the medication ordered by the physician. And doing this, the air will allow the medication to be drawn out easily because negative pressure will not be created inside the vial. So open the aspirating needle. Then let us get some air. Okay, done. Now we will carefully insert the needle into the upright vial through the center of the rubber cup while maintaining the sterility of the needle. Okay. Let us set aside first all the syringes. Okay. So like dart it. Okay. Next is then inject the air into the vial, keeping the bevel of the needle above the surface of the medication. The bevel should be facing upward so that the sharp tip can pierce the skin first. Also keeping it above avoids creating bubbles in the medication. So release air. And we draw the prescribed amount of medication using either of the following methods. So by holding the vial down where it holds from the base down, so like this, and move the needle tip so that it is below the fluid level, and withdraw the medication. So this method is said to keep the vial in the upward position while withdrawing the medications, allow particulate matter to precipitate out of the solution. Leaving the last few drops reduces the chance of withdrawing the foreign particles. And for the next technique is to invert the vial. Ensure that the needle tip is below the fluid level, and gradually withdraw the medication by keeping the tip of the needle below the fluid level. It prevents air from being drawn into the syringe. So in this procedure, we will be using the second method, which is to invert the vial. So invert. Next is, now we will have to get some medications. Okay, then done. So now we will have to get this. Okay, it's okay. So notice if there are some air. So let's clean the vial first. because some medications, so okay, like this, so there's no air at all. Okay. Okay. So now we will have to remove the aspirating needle and replace it with the right size of needle to be used for the actual administration of medication. So now after we have to discard to discard the aspirating needle if we put the cup on it. So the technique is just like this, like a fish hook, to avoid needle prick. So like that, then remove the aspirating needle. Okay. So it is okay because you know the aspirating needle is covered, but to maintain security and to be safe, um, um, throw it into a sealed container like this. Make sure after we have to discard the aspirating needle into the waste receptacle to avoid needle prick injury. So now we will insert the correct size of the syringe. So insert it. Okay, okay. Now this syringe is ready to go. So you can put it on the medicine tray. Now make sure that we write the medication ticket, including the name of the drug and the dosage, so we will be guided what medication is drawn into the syringe. So let's write it. Now let's proceed in preparing medications from ampule. Now we'll proceed in preparing medications from ampule. We have to perform hand hygiene and observe other appropriate infection prevention measures or procedures. Now, in preparing the medication ampule for drug withdrawal, we have to flick the upper stem of the ampule several times with a fingernail. So this will bring all medication down to maintain the portion of the ampule. But before that, I will just gonna check the doctor's order if it is the right prescription for the right patient. So I will just get my pen. Okay. Now I will also check the MAR if the drug is appropriate. Okay. Now let's proceed in the procedure. Now we should flick the ampule. Okay, done. So I have already fricked my the ampule. Use an ampule opener or place a piece of alcohol wipe between the thumb and the ampule neck or around the ampule neck and break off the top by bending it toward you to ensure that the ampule is broken away from yourself and away from others. So the sterile gauze protects the fingers from the broken glass, and any glass fragments will spray from the nurse. Since I didn't have any gauze, so I'll be using my alcohol pads or my cotton pads. I have prepared this so that I will not be pricked to the broken fragments. Now, place the cotton over the top of the ampule. If you see the dot is facing towards in front of you like this. So the dot is here. So it should face the front. Then place the cotton over the top of the ampule before breaking out the top. So this method ensures that all glass fragments fall into the packet and reduces the risk of cuts. Okay, now let's start. Okay, so dispose of the top of the ampule in the sharp container. So this is the ampule. So as what you can see, this is how it looks like. Okay, then dispose it. Okay, and also the cotton. Next, in withdrawing the medication, we have to place the ampule on a flat surface, as what, like this. We should place the ampule in a flat surface, and we have to place the ampule into the flat surface, as what I have told you earlier. With a single dose ampule, hold the ampule slightly on the side. So aspirate the medication so the needle prevent glass particles from being withdrawn with the medication. So in giving injection replaces the aspirating needle with a regular needle. So okay, so I'll be using the 3cc. Okay, so first let us open the injection. Now remove its needle. Okay, then just let the needle on the on its container. And next is to insert the aspirating needle. So wait for a minute. Okay, like this. So okay, then discard this one. So this is the ampule. So okay, now after we have to discard the aspirating needle or the aspirating needle if we are done getting the medication. So tighten the cup and the hub needle and place over the medication tray. So first we should get this. Okay. Oh no. Should first get the cup. Okay, like that. Then place it. Then on a flat surface, get all the medication. And then aspirate so that the air will came out to the syringe. Okay, so this is how you do it. Now to avoid needle prick, you should throw the container of the ampule, as what you can see. So there are no medications. Then discard it. Then use the fish hook method or fish hook technique to avoid needle prick. So cover, then discard the aspirating needle. Okay. Here, then insert the original needle. Okay, then put it back into the container and put it on the medication tray or in the medicine tray. And after that, make sure that we write the medication ticket during the name of the drug and the dosage, so we will be guided what medication is drawn into the syringe. So these are the medications that I have done earlier. So this is for the subcutaneous injection and intramuscular injection. So for subcutaneous injection, which is the vial, subcutaneous injection is the introduction of a small amount of solution by means of syringe and needle into the adipose tissue beneath the skin. So this is as you can see, this is the vial that I have done earlier. And next, for the ampule, So for intramuscular injection, I have used ampules. So intramuscular injection is the introduction of medication deep into the muscle tissue where a large network of blood vessels can absorb it readily and quickly. So this is the ampule. And I have prepared all that I need. So let's proceed into our working phase. Okay, so for subcutaneous injection or vial that I have prepared earlier, now in this procedure, we have to follow the 3 checks by the doctor's order and the patient's chart. So before withdrawing the medication. Next, we have to provide clients privacy by closing the door and ensuring patient's comfort by adjusting the temperature and lighting. And now we have to introduce ourselves and verify the client's identity using agency protocol, since this ensures that the right client receives the right medication, and explain the procedure to the patient. Okay, so hi sir, good morning. My name is Gerald Ababa Visar from PSN 111F, your student nurse for today. And for verification, may I know your name please? Or before anything else, can I have your wristband? Okay, thank you. So can you please take me your full name?
Joshua P. Fernandez.
Okay, so how about your birthday?
January 2004.
Okay, thank you. So explains the purpose of medication and how it will help using language that the client can understand. Includes relevant information about effects of the medication. Information can facilitate acceptable of a compliance with the therapy. So sir, do you have any questions about the medications?
No.
Do you have any allergies or what? What dialect do you prefer?
English.
Okay, so thank you. So, okay, that's great. So, for today, sir, I will be doing a subcutaneous injection where I'll be injecting insulin into your abdomen area. Would that be okay with you?
Yes.
Okay. We will be administering insulin to control your blood sugar level, since that you have a type 1 diabetes. So it may have a side effects such as redness or itching. It could redness or itching on the injection side, but rest assured, sir, that we will be monitoring your health. Would that be alright?
Yes.
Okay, so we have to perform hand hygiene and wear our clean gloves to avoid cross-contamination among our patients. And now assess the client to a position in which the arm, leg, or abdomen can be relaxed depending on the side to be used, since a relaxed position of this side minimizes discomfort. So, sir, can you please go on this side? Okay. Are you comfortable with that position?
Yes.
Okay, thank you. So we must obtain assistance in holding an uncooperative client. This prevents injury due to sudden movement after needle insertion. So next is to select and clean the site that is free from tenderness, hardness, swelling, scarring, itching, burning, or localized inflammation, and site that has been used frequently. Now, since we are going to administer it on the abdomen of the patient, we have to palpate the site and avoid any area that is tender. So, okay, sir. So, is it okay with you that I will show your abdomen for me to be able to palpate your abdomen?
Yes.
Okay. So, I'll be palpating. Okay, So, sir, are you feeling any pain on your abdomen?
No.
Okay. So, alright, for us to make sure that we have the right size of the needle, use the thumb for finger of the hand to grasp the skin of the tissue and measure the fold from top to bottom to ensure the needle is half as long as the skin fold. Okay, so. Sir, can you please relax your abdomen? I will pinch it fast. Now we can wear the clean gloves, or I wear my clean gloves right now. So as a agency protocol indicates, cleanse site with an antiseptic swab. Start at the center of the site and clean in widening circle to about 5 centimeters to 10 inches. Allow the area to dry thoroughly. This mechanical action or swabbing removes skin secretions with contain microorganisms. So I will just get the rest. Okay, so placed and hold the swab between the third and fourth fingers of the non-dominant hand, this hand, or position the swab on the client's skin above the intended site. Using this technique keeps the swab readily accessible when the needle is withdrawn. Okay. Okay, then we should discard the cotton swab. Now we will prepare the syringe for the injection. So this is the vial that I have prepared earlier. Now remove the needle cup while waiting for the antiseptic to dry. Pull the top straight off to avoid contaminating the needle by the outside edge of the cup. The needle will become contaminated if it touches anything but the inside cup of it, which is sterile. So like that. Then remove the needle cup to its proper receptacle. Okay, next is we should grasp, or we should inject now. Okay, or we should dispose the needle cup and we are injecting for medication. So grasp the syringe in your dominant hand like this, and by holding it between your thumb and fingers with palm facing to the side or upward for 45 angle like this, angle insertion, or the palm downward for a 90 angle insertion, and prepare to inject. Using the non-dominant hand, pinch or spread the skin at the site and insert the needle using the dominant hand and a firm, steady push. So pinch like that, then inject. Okay, so right now, since that this is a return demonstration about subcutaneous injection, we will be using eggplant to really show you the procedure. Okay. So pinch, 45 angle. Okay, then done. So some nurses find it easier to move the non-dominant hand to the barrel of the syringe and the dominant hand to end of the plunger. So injects the medication as what I have shown you earlier, and the syringe steady and depressing the plunger with a slow, even pressure to ensure even pressure and minimize client's discomfort. So I am done injecting the medication. So after that, put a cotton swab on it, or a cotton balls to clean the skin or the abdomen. Now we can remove the needle as what I have shown you by pulling along the line of insertion while depressing the skin with your non-dominant hand. So if bleeding occurs, use the cotton balls. Okay. So apply pressure to the site with dry sterile gauze until it stops. So bleeding rarely occurs after subcutaneous injections. So can you please hold it for me? So dispose the supplies approximately, such as the syringe gauze, syringe gauze, and the working gloves. So after this, we must assist the patient into a comfortable position. Okay, so let us discard this needle and the cotton gauze. And now we should cover these exposed area. Now, sir, we are done administering the medication. Please refrain from massaging the area, sir, to avoid discomfort. So I'll be heading out now so that you can have some rest. And thank you for your cooperation. So after withdrawing, check again the administered medication and dose. Then do aftercare, dispose used items in appropriate waste receptacle, return other equipments to its proper placed, especially the MAR machine. Now we can perform hand hygiene. So dispose all the materials, but I will just update the MAR chart and the doctor's orders chart. Now we can dispose the gloves and the other equipments that I have been used. Okay, so okay, now we can perform hand hygiene. And after performing hand hygiene, documents all the relevant information based on the procedure, document all the medication given, dosage, time, route, and any assessments. Now we will proceed to the intramuscular injection. Now in the procedure, we have to follow the 3 checks by check the doctor's order in the patient's chart before withdrawing a medication. Next, we have to provide client's privacy by closing the door and ensuring the patient's comfort by adjusting the temperature and lighting. Now we have to introduce ourselves and verify the client's identity using the agency protocol, since this ensures that the right client receives the right medication, and explain the procedure to the patient. Okay, sir, my name is Gerald Ababa Bisara, your student nurse for today. But for verification, can I have your wristband, please? Can you please state me your full name,
Joshua P. Fernandez.
your birthday?
January 10, 2004.
Okay, great. So for today, sir, I'll be doing an intramuscular injection where I'll be injecting toxoid in your deltoid muscle located in your upper arm. Would that be all right with you?
Yes.
Okay, so we will be administering toxoid vaccine to avoid bacterial infection and tetanus. It may have a side effects such as a swelling or itching on the injection site, but rest assured, sir, that we will be monitoring your health. Would that be great?
Yes.
Okay. So assist the client to a supine, lateral, prone, or sitting position depending on the chosen site. If the target muscle is the gluteus medius or the ventrogluteal site, have the client in the supine position, flex the knees. In the lateral position, flex the upper leg, and the prone position toe, since appropriate positioning promotes relaxation of the target muscles. So, sir, can you please sit down? Okay, just like that. Okay. That'd be great. Okay, so now obtain the assistance in holding the uncooperative client, as this prevents injury due to sudden movement after needle insertion. But my patient is so cooperative, and procedure is for uncooperative patients. So select, locate, and clean the site. We have to select a site free of skin lesions, tenderness, swelling, hardness, or localized inflammation, and one that has not been used frequently. So let us first locate what site we will be using. Okay, so the site that are free from lesions, rashes, and other forms of lesions in the skin. So this side, okay. So if injections are to be frequent, alternate sites and avoids using the same site twice in a row. So these reduce the discomfort of the intramuscular injections. Now we will be locating the exact site for the injection, and we are going to administer the medication on the deltoid muscle located in the upper arm of the patient, which is this side. Now we will now wear our clean gloves before starting with the procedure, but before that, we will first do hand hygiene. Now clean the site with an antiseptic swab using a circular motion. Start at the center and move outward about 5 cm or 2 inches. Okay, so let's discard the trash bin. Now discard. Next is to transfer and hold the swab between the third and the fourth fingers, as what I have did earlier, of your non-dominant hand in the readiness for the needle withdrawal, or the position the swab on the client's skin above the intended site. This will help reduce the discomfort of the injection. Now we will now prepare the syringe for the injection. And this syringe has the medication in it. First, remove the needle cover and discard without contaminating the needle. So remove it in its proper receptacle. Now, if using a prefilled anti-dose medication, take caution to avoid dripping medication in the needle prior to injection. And if this does occur, wipe the medication of the needle with a sterile gauze. So injects the medication using the Z-Track technique. So uses the ulnar side of the non-dominant hand to pull the skin approximately 2.5 centimeters and 1 inches to the side. Under some circumstances, such as for an emaciated client, for an infant, the muscle may be pinched. Okay, so let's proceed. Okay, so wait for a minute. Now pulling the skin and subcutaneous tissue for pinching the muscle, make it firmer and facilitates needle insertion. Next is holding the syringe between the thumb and forefinger as a holding a pen. Pierce the skin quickly and smoothly at a 90 angle. Use a quick motion lessens the client discomfort. Now, next is to hold the barrel of the syringe steady with your non-dominant hand and aspirate by pulling back on the plunger with your dominant hand. Aspirate for 5 to 10 seconds. If blood appears in the syringe, withdraw the needle, discard the syringe, and prepare the new injection. If blood does not appear, inject the medication steadily and slowly. So it's approximately for 10 seconds. Okay, so now in withdrawing the needle, I will be using the second method. Now, withdraw it smoothly at the same angle of insertion. This minimizes the tissue injury. Now, applies gentle pressure at the site with a dry sponge after inserting the needle, inserting the medication and the needle to the patient. Hold it like a pen, like this, and then insert the needle so that the client would not feel discomfort on you. Okay. Done. Now, it is necessary. It is not necessary to massage the area, but first we should put some cotton balls on the patient's arm. Now, it is not necessary to massage the area at the site of the injection. Massaging the site may cause the leakage of medication from the site and the result of irritation. If bleeding occurs, apply pressure with a dry sterile gauze until it stops, like this. Now, activate the needle safety device or discord the uncapped needle and attach syringe into the proper receptacle. So, can you please hold it for a while? So after this, we must dispose our gloves and assist the patient with a comfortable position. Should dispose this. So there are no bloods yet, okay? Now we can properly dispose this and our gloves. Now, sir, we are done administering the medication. Please refrain massaging the area, sir, to avoid discomfort. So I'll be heading out now so that you can have your rest. Okay, so thank you so much for your cooperation, sir. After withdrawing, check again to administer medication and dose. And don't forget to cover the exposed area and return the patient to a comfortable position. Listen. So do aftercare, dispose used items in appropriate waste receptacle, return other equipment to its proper place, especially the MAR machine. Now we can perform the hand hygiene and documents all relevant information based on the procedure, document the medication given, dosage, time, route, and any assessment. And that's it. That's the end of my return demonstration. Thank you for watching.